I'm Martin Lee with Project CBD, and today we're having another edition of Cannabis Conversations. Our guest is Dr. Paula Dell'Stella, and she is a doctor in São Paulo, Brazil. And we're going to talk about her practice, which involves something called functional medicine. So maybe you can explain to us, Dr. Dell'Stella, what is functional medicine and how does cannabis or cannabis therapeutics relate to that?
Great. First of all, it's a pleasure to me to be here, Martin. Yeah, your work in the project CBD, it's amazing. Congratulations. Thank you. Yes, I work with functional medicine. That is it's an area of the medicine that we, as doctors, we are searching for what is wrong in the lifestyle of the patient. Science is showing us that 80% of the disease is very related to our lifestyle and less related to our genes. So this is very important. It's very powerful, actually, knowledge. When you know that your lifestyle is promoting your disease, you have the power of changing it, right? So functional medicine is it's looking for what's wrong. What are you doing wrongly? So it includes exercise. Diet, of course, is the base of our health. Vitamins and supplements, how are your hormone balance, how is the power of your detoxification. So all combinations of those things create and promote disease. So in terms of years, it's very interesting to observe that the patients, when they got a chronic disease, they don't look in the past and they don't identify, like they say, yeah, but I'm eating this bread or this thing or this food for years and I never felt anything. Yeah, but now you got a disease. And if we don't pay attention in what we are doing every day, we are creating the seed that we're gonna have that in the future. So through functional medicine, you can change your future. Instead of having a chronic disease and have to use medications to treat your symptoms, you can have the power of changing your lifestyle right now, your life, and then changing your future. And what is related to cannabis, yeah? I am one of the first doctors in Brazil to prescribe cannabis. So I'm doing that since 5 years, 5 years ago. And what I realize, it's about two things. One, it's our endocannabinoid system that is related to our lifestyle, yeah? So what means creating disease? Creating disease means, for example, if you are a negative person and you have, every day you wake up and you have negative thoughts, you are expressing types of genes. If you are a positive person, you are expressing different types of genes. So if you have good relationships, you're expressing types of genes. If you have a bad relationship, either. And this goes to every part of your life, and we never correlate that to our disease. And the correlation going further means our endocannabinoid system is correlated to all systems in our body, right? So when we are creating stress, and creating stress means not just stress about thinking, but it's about food, for example. Too much bad food create a stress in our body. This stress causes inflammation. And when you have inflammation or we have a disturbance in our endocannabinoid system, we are more open to have disease. So what I do in my practice, it's focused very much in the lifestyle, but using cannabis as a tool to treat in a more gentle way the symptoms that those patients still have. And of course, they cannot just drop the medications from one day to another. We have to do it through time. And cannabis is a tool to help those patients to pass through this modification.
So you found that cannabis can help patients wean off of pharmaceuticals or lessen their use of pharmaceuticals? And in what particular areas or conditions are you finding in your practice that cannabis seems to be particularly helpful for, or most helpful?
Sure. Actually, yes. The first question you did to me, it's completely true. I have a lot of experience with patients that arrive in my office using 10 medications, 5 medications, like really polypharma, we call them. Because of course, with 10 medication, nothing's working properly, right? Even like we don't know what is working or not. It's a very hard, actually, to treat those types of patients, and I'm seeing much more. It's very common. They are changing to doctors. Any doctors doesn't change the prescription of the doctor before, and they are accumulating a lot of medications. So yes, cannabis is a very great tool to help those patients to take off many of them. Sometimes, like the patients, they keep like 1 or 2 instead of 10. But then again, lifestyle modification and cannabis. Because probably the 10 that they're using, it's very related that we're not doing in their lifestyle. So yeah, for sure. And what I see very common in my office, it's, well, I did my post-graduation in neuro-oncology. And because of it, I receive a lot of patients related to oncology. So functional medicine is a very wide field for patients, right? So oncology is one of the types of patients that I see very great results.
So cancer patients, and you said neuro-oncology?
Yes.
Is that, so that's a specialty within, among cancer patients, implying cancer of the nervous system, of the brain? Maybe you can talk a little bit about that. What have you found with patients when they begin to use cannabis or particular cannabinoids like CBD or THC, and they're dealing with the cancer in a neuro-oncological perspective, maybe a brain cancer? What has been the results? Because this is a very serious disease.
This is a very serious disease. I just recently published in Frontiers Oncology the result of 2 case reports where we introduced CBD in a certain type of a moment of the treatment of those patients. So both of them, they had a GBM, or a glioblastoma, is the most aggressive form of brain cancer. Also, they have a very similar profile and age, and they both were men. And so it was very interesting to observe the response of both of them. So what we did, they both went to the surgery. They were biopsy again, so it was confirmed it was GBM. What we did was, after when they were going through chemoradiation, and then after chemotherapy alone, a type of very aggressive chemotherapy actually, we introduced CBD in that moment. And we let them actually tell us how they could stand, so how much they could stand. We didn't give them how much they will use, they respond to us. So one of the patients used 450 milligrams and the other one used 200 milligrams. And it was interesting to observe that the one that used 200 milligrams actually had a better response. So yes, it's with.
And is that idea that maybe less sometimes has a more of a response? Is that something you've seen in other applications with patients? A kind of this less is more approach for cannabis therapy?
Yes, actually, you know what I'm doing? I try to put my patients in the lowest dose with the best benefits, therapeutic benefits. So yes, I really believe that in a chronic use, we don't need too much, actually. There's types of disease, of course, that you have to be specific, as certain children's using for convulsion. For example, if they use a little bit more, they get a seizure. If they use less, they get a seizure. So it must be precise. For cancer patients, we don't have answers. I mean, in terms of how much. I do see a difference in response. And I think it's related to the endocannabinoid system of the patients too. So the genetic of the patient, how he can metabolize it, and how the interaction of the cancer with your system, and then so it's a very complex thing. What we observed in those patients, that the first after the first month of chemo, radio and chemo together, They came with a very impressive inflammatory response. What was impressive for us was very quickly actually to have this response. It was a very robust response. So the image, when we saw it after a month, they said, "Oh my God, they are having a progression." But instead of having a progression, they were having a pseudo progression. It means it's not a real progression. It's a very intense response to the treatment. It's very good actually. They were clinically performing very good actually. They were doing exercise, they were bicycling. I was really impressed to watch it. And after it, they follow up with chemotherapy. And the chemotherapy they were doing, as I said before, was really aggressive one with 3 types of different drugs using in certain types of moments during the month. And it's a very toxic type of chemo. With some types of patients even can go until the end because of the toxicity of the brain, the liver, the blood cells, so it's very intense. Both of them, they vaporize our THC flowers during that moment, and they keep using CBD. And what we noticed that was really impressed, that the clinical performance of them were improved. And so, of course, they had fatigue, they had nausea, they were laying down in the bed. But comparing with other patients, they were in a moderate, side effects. So sometimes one of those patients could work, like having a social activity, even doing that. Yes, it's impressive because in my point of view, I think that cannabis, for those in oncology specifically, what I see, people, the patients, they are more, you see more energy. They become like, they perform better. They are more resistant to the stress of the treatment, even psychological speaking. So I think the interaction of the medication with the system in all sense of it, not just the physical, but the psychological. And they sleep better, they are in a better mood. So everything facilitates the end of the treatment. You are promoting quality of life. Yeah, so the whole thing is creating an ecosystem that is better for them.
So you were seeing not just positive results in terms of cannabis helping the symptoms, the difficult symptoms that arise because of chemotherapy, the nausea and so forth. Were you also seeing impact on the tumors, the brain tumors themselves, that were showing positive signs?
Yeah, what we have in science, the researchers already, they prove that what happens in culture of cells and in rats, it happens in our brain too, for glioblastoma, I'm speaking. We don't know the answer about those patients. I mean, in terms of survival, we need more patients to observe. It's a very, what was a small population, but GW just released the phase 3, if I'm not wrong, 2 or 3, of the combination of Sativex with the treatment of GBM. And what they saw there is around 83%, if I'm not wrong, improved in the survival time. And it was really is nice actually to have these results, because then yes, we are seeing that it can really have an anti-tumor effect in combination with the treatment. Because if the last time when I was spoken with the team of the researchers, they said to me something really important, and we are seeing in the results of research. There is a positive interaction between the chemotherapy and the treatment with cannabinoids. So for some doctors, they are afraid because of the antioxidant properties of cannabinoids, and could damage, the treatment, could not be a good combination. But no, instead of it, there is a synergic effect on tumors when you combine those.
So you mentioned GW Pharmaceuticals as their product Sativex, which is a combination of CBD and THC as a tincture, as a sublingual kind of one-to-one relative. Is this generally available to medical patients in Brazil? Are there other cannabinoid remedies available to patients? And what is the situation if one just wanted to get a cannabis-based medicine and use it on their own, as you can use that now in California and other states, if the laws are permitting it. What's the situation in Brazil?
Yeah, Brazil, it's California 20 years ago, let's say that. So it's becoming popular. The doctors are getting their education slowly, but the patients are coming with, they want to use it. So what I'm seeing right now, like in terms of what's going on legally, yeah, you asked me about Sativex. Sativex in Brazil, it's called Mevatil. It's a different name, and we have in the pharmacy. It's not easy to find. I just had a problem with a patient 2 weeks ago. He's a multiple sclerosis MS patient, and we were trying to find the medication to him, and we couldn't find in any pharmacy. And I called to the pharmacy and I asked, why you don't have it? And I say, yeah, because it was here for 2 years and nobody prescribed it. So we deliver it back. So yes, we have Sativex. We don't have Epidiolex, of course. It's I think it's not even available here. It's already available.
That's basically pure CBD for the children with very severe epilepsy. I do think it is as a prescription.
So it's already in the pharmacy.
Yeah, but only with the doctor's prescription.
Yeah, no, in Brazil we don't have Epidiolex yet, but what we have in Brazil are a lot of companies from abroad bringing CBD made by hemp to Brazil. So we have a combination of THC and CBD in the pharmacy. Very expensive for Brazilian economy. And then we have products made by hemp, CBD made by hemp, into the country with these international companies. So for a doctor that we have a very limitation in prescriptions, I mean, in terms of cannabinoids and compositions and everything that we could do. It's very limited, unfortunately. Brazil now it's getting a public consultation, our FDA, our Anvisa, the name of the organ that regulate medications in Brazil. It's open a public consultations to understand what we think about having our own cultivations as a country, yeah? So produce our own medication. Because we are receiving, it's not a medication, yeah? We even are not sure if what it's saying in the label, it's
with the CBD products.
Exactly, yeah. It's already inside the products. So we are in a moment right now that we need to focus on quality control, education, manufacturing, and the whole process to be able to produce a quality control human consumption product. Like we still are not in that part in Brazil. Like we need to improve it as a country. I mean, we don't have a regulation yet. So for a doctor, I prescribe what we have. We have the medications from abroad made by hemp. And you ask about the illegal market. The illegal market probably is 10 times bigger than the regulated. What is the regulated? For a patient now receive medical cannabis in Brazil, he must through process, a bureaucratic process. It means going to a doctor that knows how to prescribe cannabis and make all the documents to these patients, get inside the Anvisa, apply for authorization. After 52 days, the authorization arrived, and then he can buy using those companies' products. So can you imagine for a person with a high condition, like a very a bad condition, and you cannot wait for 52 days plus 10 days to arrive your medication? Doesn't make any sense. So what normally everybody does, they go to the black market because in 24 hours you resolve your problem.
I think what you described about Brazil is not uncommon, even still in the United States. The black market exists along with the not so black market. It's kind of all helter-skelter and happening, but fortunately there's an increasing number of options that patients have. Hopefully that'll happen soon in Brazil. We thank you, Dr. Paula Dell'Stella, and good luck on your work.
Thank you so much. Thank you.